Hope is on the horizon for patients suffering from peripheral artery disease, which commonly affects diabetics.
A new surgery pioneered in the South Bay can open the artery, allowing the free flow of blood to limbs at risk of amputation. Our Jesse Gary live in San Jose to bring us more on the procedure and its impact. Jesse.
Good morning, guys. Yeah, we're in the offices of Dr. Padidar, Arash Padidar, who is an endovascular surgeon. And Doctor, this new surgery, you're telling me you don't need scalpels or knives, etc. This is all laser-based.
Absolutely. This new device called the DABRA device vaporizes any plaque inside your blood vessels and revolutionizes what we have done. We can do it much faster without the use of many balloons and stents that we used to do before.
So typically a person would come in, a diabetic perhaps, with a blockage in one of their blood vessels here or veins here.
Absolutely. The blood vessels that we see on an x-ray will be shown to be narrowed, and after that, without making an incision, just going through their blood vessel through a tiny little needle in their leg, we go under imaging to the blood vessel, and on contact we can actually burn it. And let me demonstrate for you.
Please.
This is a tomato, and this is the laser device, the DABRA device, and it's really amazing. And you can watch it. It literally burns right through.
Burning through the tomato?
Burning through the tomato and vaporizing the plaque. Other devices used to have little debris and pieces go down the leg and cause blockages. This device can dissolve it, and we don't have to go fishing those little pieces anymore. So it really has revolutionized what we can do.
Give me an idea of what the patient goes through. I mean, do you have to be knocked out completely, or are you partially awake, or how does that work?
The patient is usually awake, but in twilight. It takes about an hour and a half to do the procedure. It's done through the leg. The patients usually are talking and joking with us. Afterwards, they get a Band-Aid on their groin, and we watch them for a couple of hours, and then they are discharged home.
And usually, when you'd have like a blockage, you'd have to do some kind of bypass where a patient would be, sidelined for weeks, and that's not the case anymore?
That's correct. We are called the endovascular surgeon, basically image-guided surgeons of the 21st century, and we don't do any more open procedures. This has completely replaced open surgery.
Doc, it sounds amazing.
Yeah.
And this is an example of somebody who had like a blockage in their foot, et cetera. And this is something where this would help this kind of patient.
Yes, I would say if you cannot walk or you're getting cramping in your legs or calves, go see your doctor, because there are techniques that we can do without surgery. Don't be afraid. You're not going to have surgery. You can go home the same day and return to your normal daily activities. It's really remarkable what this DABRA device has done.
And pioneered here in the South Bay.
Absolutely, yes.
Doc, appreciate your time this morning, and appreciate.
Thank you very much.
By the way, that does. Yeah, but it wasn't too bad. It wasn't too bad.
It was fantastic.
Thank you, Doc.
Thank
I appreciate that.
Okay.
So there you go. If you are a diabetic, or if you just have problems with your legs, with your arteries, no surgery, no scalpels, etc. No bypasses. That whole thing will just vaporize the blockage. Absolutely. We're live in San Jose. Jesse Gary, KTVU, Fox 2 News. We'll head back to you guys up in Oakland.
Jesse, thank you.